In my role as hospice liaison, I have the privilege of meeting families first. Once they've been given that diagnosis or prognosis, and when the physician feels that hospice would be appropriate, we determine what would be the best way to achieve their goals, to build a safety net underneath the patient and the family so that they don't feel as if they are alone in this situation. Many times the patients' families are just amazed that I don't have to do that. I said, no, you be the family. Let us be the nurses, you be the family, because that's all they really want you to be. When looking back over my career, almost 30 years as a nurse, my 26-year-old sister had a cerebral hemorrhage, and we only had her for 24 more hours. But she was in the ICU setting with tubes and lines in every possible place. But the thing that struck myself and my other sister was the fact that Joni was treated as a human being, not as a patient. And I watched when they were treating her with such dignity, knowing that we'd have her for such a short while. And I know my other sister and I both became hospice nurses because we wanted to give back what we had received as a family, and knowing that it wasn't all that equipment, but it was the touch when they were combing her hair and bathing her, putting lemon glycerin on her lips, and she died just like she lived. And I guess that's what it's all about. There's nothing heroic about hospice. Hospice is what we're supposed to do. We're supposed to take care of each other. We're supposed to take care of we're supposed to be there for the good times and the bad times. But that's what, people will say, well, how can you do this work? How couldn't you? Because that's basically what human beings should do. And I think that's why we were put on this planet, is just to help each other through the rough spots and then to be there to rejoice in the happy times.